This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Professionals, I can assure you that research is real. For some, the symptoms are acute. Other times, waves of emotion will bubble up weeks or months after a stressful event. For the first time in my career, I've had to seek mental health help, and I'm glad I did. If any of you are having problems, please reach out for help. So before I go on, I want to thank all of you who have provided incredible care and effort to Nevadans. It's not been easy, but your work inspires me. As the pandemic, many people are talking about getting back to normal, and pandemic maybe. Why do we want to get back to normal? Well, we obviously want to get back to normal in so many aspects of our lives. But as we've heard today already, there are a lot of issues endemic to healthcare that have been worrisome. In the United States, we spend more money and we have worse health outcomes compared to other countries. If you live in a rural area or are Black or Hispanic, you're more likely to have heart disease, cancer, diabetes, and a whole host of other diseases, and you're more likely to have bad outcomes from those diseases. COVID has shed light on mental health issues in kids. This is not news for those of us who have been working in these areas for years. My dad's a retired child psychiatrist back in Michigan. Growing up, I'd hear stories about the barriers to adequate care. Sadly, we're treading water at best in this critical area. One of our barriers is Nevada's physician shortage, one of the largest in the country. The Nevada physicians I talk to feel overworked, and they're desperate to bring in new physicians to Nevada, but they run up against too many hurdles. We need to make Nevada a state where doctors in all specialties want to come to practice. And it's not just physicians. We're battling shortages in nurses, PAs, APNs, and pretty much every other healthcare professional. Tight staffing models have always been a stressor, and then adding in the record numbers of deaths and hospitalizations to COVID may be the straw that broke the camel's back. COVID has shed light on our lack of diversity in healthcare professionals, and my good friend Dr. BCW is going to be addressing that in a few minutes. Before COVID, even when things were normal, we were seeing an increasing distrust in the medical community, and in particular, growing anti-vaccine misinformation. When things were normal, we had huge gaps between the private medicine sector and public health. And despite advances in digital technology, our ability to transfer meaningful healthcare information between hospitals, clinics, and public health agencies seems to be getting worse. So why would we want to go back to normal? So for those of you who know me, I tend to be optimistic. I think we can make a difference. And if I didn't, I'm not sure why I'd be here. What is the solution to finally fixing the problems that have been plaguing us for so many years? I'll give you a hint. It's in this room. Look around. You guys are the solution. During COVID, I've been blown away at the ingenuity and creativity of healthcare professionals in Nevada and across the world. Seeing these new collaborative efforts makes me proud to be a physician. Today, we're already seeing some great health solutions to our problems, and in the past few years, Governor Sisolak has started programs like the Patient Protection Commission to help fix some of these problems. For me, one good thing that's come out of the pandemic is I've made new connections with incredible people throughout the state. I've met physicians, public health experts, first responders, and other healthcare professionals, learning from their insights. Over the years I've been in leadership, I like to study leaders to see what qualities work best. And as a family physician, listening to my patients is paramount. As NSMA president, the most important thing I can do right now is listen to our community. NSMA is here to listen to Nevadans and to everyone who is providing care for them. If you have solutions or ideas, please reach out. Only by listening are we going to be able to come up with grassroots, battle-born solutions. We have unique medical problems in Nevada. To fix those, we need to tap into your knowledge and expertise. So let's not go back to normal. Let's finally do better. Thank you. So next up, I have the distinct honor of introducing my good friend, Dr. Bayo Curry-Winchell. She is the, she does a bunch of stuff. She's clinical director with Carbon Health, is co-director for their DEIB committee. She's the medical director for St. Mary's Healthcare in Reno, Nevada. She heads up the Washoe County Sexual Assault Response Team. She is also currently the president-elect of the Washoe County Medical Society, and she is the co-chair of our NSMA's new Diversity and Equity Committee. So, Dr. BCW.
Thank you, everyone. It is a true pleasure to be able to speak in front of you and just have the invitation to really be a part of such an amazing event. So, hi, my name is Dr. Bayo Curry-Winchell, and I am honored to receive this invitation from the governor to speak to you today. I'm a mom of 2 young girls, a wife, and a family medicine and urgent care physician who is passionate about finding ways to decrease health inequities for the BIPOC community, finding ways to reshape the delivery of health literacy, and advocating for an increase in diversity and representation throughout the medical field. The pandemic has changed all of our lives. As a country, we have faced challenges personally and professionally that have allowed us to grow in ways none of us could have imagined. But we have tackled those challenges, and we continue to push forward. I am very proud of the state of Nevada in recognizing the gravity of this disease and its potential impact on Nevadans. As a native Nevadan and Black female physician, I was acutely aware of the inequities and disparities present in the BIPOC and underserved community before the pandemic. I knew it was important to find different ways to reach our community to help ensure they had access to timely, accurate, and accessible information and care that would really be innovative during these challenging times. To do this, I knew I needed to share why I trusted the vaccine. I needed to find ways to debunk misinformation and highlight why people of color had mistrust in public health long before 2019. I worked with leaders and influencers inside and outside healthcare to create new opportunities to deliver health literacy beyond the walls of a traditional clinic. This included collaborating with colleagues like Dr. Pasternak and Nevada pastors to create health and faith informational sessions, organizing vaccine clinics at churches, and speaking to the University of Nevada, Las Vegas, and Reno athletes, and just being present to answer their questions. We worked to deliver information to people in their community. And when I say that, it's important to think of how we did that and how we need to do that moving forward. That means finding their safe zones, what is important to them, and then sprinkling in health information. And that's how you're going to keep people informed and help them feel comfortable to ask any question they have about any disease, including COVID-19. As healthcare professionals, we have a critical role in fighting health inequities. We have real power to push the healthcare systems to improve access, fight mistrust, and improve equality. As healthcare professionals, we all know far too well that health is a person's most precious commodity. And with impacts from the pandemic, it is something that we have to continue to invest. Because if we want to make change, we have to reshape how we reach people. We have to reshape how we deliver health information. And I am so grateful to be in the room with all of you as healthcare professionals, because we know what we've gone through and we know what we can continue to do. Thank you so much for allowing me this opportunity. And now I'd love to introduce our amazing governor, Governor Sisolak.
Wow, thank you so much. And it is, I'm understating when I say it is an honor to be here with you all today. I've got some prepared remarks, but before I get to my prepared remarks, I want to say some thank yous. An event of this magnitude and this importance does not happen by chance. Countless hours went into organizing, improving, and facilitating this event. And I want to give some personal shout outs to my staff that played such an instrumental role in this. And if I could ask them to stand when I announce their names, and I hope I don't miss anybody, because they made such an enormous difference. My Chief of Staff, Ivana Kinsella, is here somewhere, I know. There she is, okay. If you can stay standing, please, thank you. You don't have to applaud after every one, because it's about a dozen names. But they each deserve attention. Madeline Barak, Emily Nowlin, Bailey Bordelin, Megan Delaney. I don't see you guys all standing up, okay. Allison Genko, Stephanie Betts, Adina Fitzgerald, Dwayne Young, Cecilia Heston, Elizabeth Castillo, Eric Cardona, Daniel Stewart, Dr. Kristen Averett, Randy Brems, Tim Robb, and the Director's Office at the Department of Health and Human Services. Please join me giving them all a well-deserved round of applause for all that they do for us. This would not have been possible with all of their effort and all of their care, and I sincerely appreciate that. And in addition to my staff that's been here, we have dozens and dozens of volunteers that are working here today at the various booths. You've seen them. They've helped us with getting people in and out of here, keeping everybody safe. And I want to give a shout out to all of our volunteers that have also done so much. So thank you all for what you've done to make this day possible. Now I'm going to get into remarks, so my time starts now. Madeline, just so you got that. Good afternoon, Doctor. Thank you all for being here. Dr. Pasternak and Dr. CW for your help in getting this done. So shorten that up. So you got the hint of this here. For sharing your stories and for the kind introduction. And thank you everyone in this room for the immensely critical and hard work you've done over the last 2 years. And I want to tell you something. You didn't just do a job for the last 2 years. You saved lives over the last 2 years. Countless lives. People that might not have come back to say thank you, people you might not remember their face, but people that you helped along the way. You genuinely made a difference and saved lives. And for that, on behalf of the great state of Nevada and the 3.2 million people that call it home, God bless you and thank you for that. I hope you all got a chance to watch the video montage that was playing earlier. It was a great visual reminder of what the last 2 years have looked like, and a reminder that we got through the pandemic together, and we'll move forward together the same way. I'm so glad we can all come together in person today after the pandemic has kept us virtual for so long. I know a lot of you are meeting each other face to face for the first time. You've become Zoom friends over the last 2 years, and now you're meeting each other face to face, and that's a lovely thing to see. This vital work and the progress is what allows us as Nevadans to get back to work, get our kids back to school, and back to their lives. Thanks to the innovative and hard work that's been done by federal, state, and local leaders and community members in Nevada, we have been able to deliver COVID-19 vaccines and testing to everyone that needs it or everyone that wants it. And we've made it more accessible than ever. And it is still available today. And I will repeat it, it's free, it's effective, and it's available for anyone. As are booster shots for those who didn't get their booster shot. We're much more ready to fight this virus than we were when the pandemic began. I remember when the pandemic began, people didn't know how to pronounce coronavirus, much less deal with coronavirus. A lot of people thought it had something to do with the beer, and they weren't familiar with what we're facing, and it was a pandemic of a lifetime for all of us. We still have a long way to go in terms of fighting COVID and beyond. I know the people in this room are an integral part of our state's mission to advance health equity and to provide the best possible care for all Nevadans, regardless of their race, their gender, their zip code, their ethnicity, their sexual preferences, whatever. It's available to everyone. Healthcare inequity has been a priority for me since day one of my administration. We know there are challenges around access to healthcare, provider shortages, cost, and other factors that this group has come together to discuss. And we're hopeful that good ideas can come out of this. Speaking with the Secretary, we're hopeful that some of your ideas can be implemented, and we can work with the federal government to get the seed money to make them a possibility, become a reality. Your time today and your efforts today are greatly appreciated. So it's important that we have your voices, your input in this conversation. We're covering a lot of very important topics throughout the day today, throughout the entire summit. And I want to focus a bit on our work on mental health support. Mental health care is for those in need is a priority for me and for my administration. The stigma associated with mental health needs to be removed. Plain and simple. There should be no stigma associated with accessing mental health. Throughout my administration, we are focused on providing more access to needed services in all of our Nevada communities, both urban and rural. In my 2019 budget, we were able to expand certified community behavioral health centers, which provide behavioral health services to all Nevadans, regardless of their ability to pay. We know that the pandemic has been challenging for Nevadans and for everyone, and we have worked to build partnerships to support Nevadans, but we can and we must do more. And we know funding is needed to reach some of our goals and to help those most in need. That's why I'm so honored and thrilled to announce my plans to make a $20 million investment of the American Rescue Plan Act funds for Nevada's crisis stabilization centers. I will continue to work with our partners, many of whom are in this room today, and members of the Nevada legislature, who, by the way, if you're a member of the Nevada legislature, would you please stand up so we can give all of you a round of applause? Those of you who are familiar with Carson City know that bills and budgets don't get passed without the help of the legislators. And I'm extremely grateful for the help they continue to provide us in that avenue. This funding will be transformational for our state, and I'm grateful we can show our commitment to establishing the most essential components of community-based crisis care. With this funding, we will be able to build the infrastructure needed for emergency behavioral health care statewide. This is a critical time for us to make this investment as we look to the launch of 988, the new behavioral health and crisis phone number. And as an added extra bonus today, I'm going to steal the Secretary's thunder, he announced in our media briefing gaggle that we just had that they are providing the state of Nevada with $1 million today to kickstart our 988 program, which is going to make a huge difference, Mr. Secretary. We really appreciate it. But it started long before with our legislation that was passed and signed over our past 2 legislative sessions. The 988 call line will provide connection to caring individuals, but once established, these crisis stabilization centers will provide the welcoming environment to support individuals experiencing behavioral health crises in their lives. I don't need to tell this group, but we know that for far too long, individuals seeking mental health care have ended up in the emergency room or foregone the request for help altogether. That needs to stop. If you need mental health care, you need to have it available. All you need to do is ask. We know this funding, again, will be transformational for our state and those who felt for so long there was nowhere to turn. They will have access to the support they need 24 hours a day, 7 days a week across the entire state of Nevada, urban and rural. The pandemic has shown us how important equitable and accessible health care is. That's why I'm glad all of you can be here today, discussing solutions and learning from each other. We have so much more work to do on behalf of Nevadans, and I know we can do it together. Now, it is my distinct honor and really a privilege to introduce Secretary Becerra, who serves as the United States Secretary of Health and Human Services. He's been a leader in our, I've got a few more things to say about him before I bring him up here. He's been a leader in our country's fight against the pandemic, and I mean he led. He led by his actions, by his thoughts, and by his words. As well as being an advocate for expanding access to care and reducing healthcare costs for everyone. He is committed to the fight to provide healthcare for all of us. I'm not sure how many of you know this, but the Secretary's first trip after his confirmation was to Nevada. He's an honorary Nevadan. And he says the state the right way, too. He says Nevada, not the other way that some visitors say it. And we appreciate that, Mr. Secretary. And we were so excited to welcome him to Carson City for a roundtable discussion we had earlier and our tour of some of our facilities we have in northern Nevada. And I'm really thrilled and proud to have him back in Nevada today. It's an honor to have him here and to have our federal partners joining us to work towards a healthier, more vibrant Nevada. Thank you for joining us, and please join me in welcoming United States Secretary Becerra to the podium.
Governor Sisolak, always good to be with you. You always keep your state moving, so I appreciate that very, very much. It was a different time when I came last year. In fact, I probably wouldn't have been able to identify you very well because everybody had to wear masks. In fact, you wouldn't have been here because you had to be distanced, right? It was just a different time. And I say this as a resident of Las Vegas because I'm from one of those suburbs called Los Angeles of Las Vegas, Nevada. So I could say this, well, it is good to see so many Nevadans in person, without a mask, next to each other, sharing a meal and also some good company. So thank you for everything you have done to get us there. I got to start by thanking the governor and his team. You, Governor, Ivana, all the folks that have been working for the people of this state for, well, at least 2 years that we've had this pandemic before us. But obviously, the work that had to be done by so many leaders is amazing now to see where we are. To all your leaders in the state legislature, thank you for having the courage to put your money where your mouth is in getting things done for the people. And so I want to thank them as well. But I'm really here to say thank you to you because I have for the last little bit plus a year that I've been secretary, have been getting on a daily basis numbers. Cases, hospitalizations, deaths. I get them every day. And so they get to be very granular. And then when you go visit places and you meet with people, and there's not a person I haven't met that wasn't impacted in some way by COVID. The tough ones were the folks who said, yeah, my mother did pass. I didn't have a chance to be with her because she was in a home and I couldn't go in. And those are the difficult ones because they happen so often. And then they do become real. And so every time I see those numbers, they take on more life. And so I have to start today by saying to you, thank you. Although it is so common for us to think numbers, and it is so easy to tally up just numbers, the reality is it's the other side of that coin that we don't talk about so much, which is the lives that we saved, the lives that are still with us, the grandmother or the father in that nursing home who actually can be visited by the loved ones now. Those are the ones that don't get counted every day, but they're there, and too often we don't give credit to the folks that made it possible for them to be alive and be with us and be hugged and kissed. So to each and every one of you, for being resilient, for hanging in there, for sharing your emotions with others and giving them the spirit and the strength to continue forward. Thank you for what you've done. And of course, because the numbers keep getting reported to me, thank you for what you will continue to do. Very much appreciated. Now, your resilience, your response, priceless. But really, what makes it so tremendous is your results, to see where we are today. I hope that what we do is remember that it's results that count. People don't really want to hear much more unless they could go into that nursing home and visit their mother. They don't want to know much more unless they know they're going to be able to go to work and their children will be able to go to school. It's results that count. And so we have to deliver those results. And for us to be able to deliver those results, you got to do more than just talk or wish it to happen. You got to put real money and real relief behind all those efforts. And so here, I want to say thank you to a guy named Joe Biden, because he delivered. He didn't just talk about trying to help the American people. When you put together a package of $1.9 trillion, more money than we've ever sunk into trying to stop a country the size of the U.S. from tanking. Remember 2008 when we were going under? We did about $800 to $900 billion in relief because we were all going down. And I remember Nevada, you probably remember your home values, everybody was going down. 1.9 trillion. That's what it took to keep you working, to let you find some place to send your children because so many of those daycare centers were closing. For those who lost their job altogether, so you could keep your insurance. It was tough. And I want to say thank you to Joe Biden, our president, because he delivered in a way that I don't think many people, and I, having served in that Congress for 24 years before I became Secretary and Attorney General for California, can tell you, never had I seen something done like that in such a tight, competitive Congress, Senate, and House. And so I thank Joe Biden, our president, because I know what he did to make it possible for us to be here without masks. But because I'm so accustomed to the numbers, let me tell you the numbers. Remember, we have some 80 million cases that have been reported of COVID in this country. We have had more than 4.6 million hospitalizations reported in this country. And if you've been keeping track of the numbers, you know that we are approaching 1 million Americans who have died from COVID, who've been reported. There are consequences. They are real. More than 120,000 children in America today don't have their primary caregiver anymore because of COVID. I mentioned those mothers, those grandparents, the disabled loved one who were not able to be with family in their last days of life because of COVID. All those who are suffering from long COVID, millions of Americans today who don't know what the answer is so they can get their health back. Lost jobs, clogged supply chains, those chains, those that we rely on to get those supplies to this country, increasing prices of all products because we can't get them through. Stressed and distressed families throughout the country. Real consequences. So here's the deal. You can't just walk the talk about doing something. You can't just wish or wait for something to be done by someone else. We all have to get up there and do something. Not just on the pandemic, because we saw our public health system has a whole bunch of holes in it. It leaves a whole lot of folks behind and lets too many fall through the cracks. And so we're getting to work to try to change that. That's why the president said when it came to the Affordable Care Act, we're going to extend the time that we allow people to sign up, and we're going to make it more affordable because the American Rescue Plan, we're going to use some of that money to make that insurance plan more affordable. So today, we can tell you that 4 out of 5 people who are eligible to get a plan in the Affordable Care Act, when they went in and tried to find a quality plan with real strong coverage, 4 out of 5 found that they were going to pay less than $10 a month in premiums for that plan. That's a story. That's a story. And the result, 14.5 million Americans now have insurance coverage because of the Affordable Care Act. That's a record number of Americans. There are more Americans today who have coverage for health care than at any time in our history, and we're still in the midst of that pandemic. And that's because we took real action, real money, and got real results. 255 million Americans have at least one vaccine shot in arm. 2/3 of seniors have been boosted. Some 350 million COVID tests have been provided to Americans free of charge. Some 270 million masks have been provided to Americans free of charge. Some 400,000 providers, like many of you here, applied to get relief from the cost of COVID. We have sent out over 766,000 different payments to those 400,000 providers, totaling $186 billion. The pandemic so far today has cost you and me, the we in government, our federal government, about $4.5 trillion in direct outlays. We invested $186 billion of that in you because you were investing your time in people. The result is that today we are here without masks. But it doesn't happen easily. And as I said, we're not done. And so here's the challenge I have for you. Because while it is important to mention that today we announced that we're going to provide Governor Sisolak in the state of Nevada with $1 million to help them launch their 988 lifeline. We're providing some $105 million throughout the country for all 50 states, the territories as well, to get them ready. And that's part of the $300 million out of the American Rescue Plan that we're investing to get us all ready by July 16th when we launch. But here's my challenge to you. We have to make this real. When someone takes the time of deciding to take the path of not committing suicide, but dialing 3 digits, 988, we have to make sure they don't get a busy signal or someone who puts them on hold. We need to make it work. It's got to be real. There has to be a voice, a professional voice, on the other end of that line. And that's where we're going to need your help. Because as Governor Sisolak mentioned, we're not there yet. We still need help. The workforce isn't where we need it to be. And so I hope all of you are prepared to help us on July 16th as we launch 988 to really make it work. Because if someone's going to take the time to actually call us instead of the alternative, it's maybe our only chance. And so we should be ready. I hope we will be. We're going to continue to work with states like Nevada to make sure that the federal government is a good partner, because we know we have to go beyond 988. Behavioral health has become a real crisis. Every 11 minutes in this country, someone is dying of suicide. And we know that it is hitting our youngest populations hardest. It is hitting those who are 10 to 34 years of age in ways that we haven't seen. We've seen about a 42% increase over the previous year in the number of people who are telling us they are about on the edge. But here's the more difficult news. For those under the age of 18, we saw an increase last year of about 50%. And so we have some real work to do. Real work to do. And so we're going to go out there and we're going to test you. I mentioned this to the governor already. We can't fund every project, but we can challenge you. You got a good idea? Bring it forward. We can try to seed you with some support. And if it works, then we take it to Congress, we take it to the legislatures, and see if we can get some more funding for that. Because we need real money to provide real relief and get real results. And so I hope you're ready for that challenge, because as tough as it's been, as much resilience as you've had to show, we now know we've got this challenge of behavioral health, mental health, drug addiction before us, and we can't stop now. And so we're ready. President Biden made it very clear in his State of the Union address. We're taking on the issue of mental health. We're disposing of the stigma. We're changing our paradigm when it comes to drug use disorder. We're going to treat people the way we need to as human beings. We're going to meet them where they are, and we're going to look for help. And so we hope you're ready for that, because the president has given us a charge. We, fortunately, through Congress, we're given some resources, and we hope if Congress finds its way to pass the President's Build Back Better agenda, we will have real money to do real work and provide real results to people who have been suffering for a long time. But remember, this is Nevada, this is Vegas. You always bet on the come. And I think we know that in this country, you don't bet against America. And so I would say, that we can get this done. Help us with 988, get a good launch out of 988, and we go from there. But to you, I will end as I started. The resilience is obvious. I hope you've been able to get a few hugs in between, but we want you to continue because we're going to give you some real money. We're going to give Americans and Nevadans some real relief because they're expecting real results. So thank you all very much for inviting me here today.
Thank you so much to all of our speakers. Can we get another round of applause for everyone? And with that, that concludes our lunch keynote. So you're welcome to make your way to the break and then to your next breakout session.
You've been watching Breaking News from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.